All right, so let's get going. We have an hour, and I'm going to see if I can stick to that hour. Okay, so here's our agenda tonight. We are going to talk about the format of the NPTE, the content outline, what contents on the NPTE, format of questions. I feel like that a lot of people know that information, so I'm probably going to go through that part a little quick. But if you have a question at any point, put something in chat, or you are welcome to unmute and ask a question before I move on. Sounded like a lot of people were really interested in how do you develop a study plan. So I'll spend some time on that. And then I think what's really important is this is huge. There's so much material, and you're trying to figure out, like, how do I study all this, and how do I get it in my head, and how do I not forget it? And so we're going to talk about best practices for studying. And I know it doesn't work. Maybe every little thing I tell you may not work for every single person, but in my experiences, this is my best recommendation for you. Okay. So I'm going to take a little time with that. Test taking tips, we're going to go through that. What are some test taking tips for taking the NPTE? What is our strategy for going back and changing answers? What should that be? We will talk about analyzing your practice exam results. If you've already taken the NPTE, hopefully you purchased the exam feedback report, because I want you to analyze that along with all your practice exams. And then we'll end with just a few tips for managing anxiety. I'm not a psychologist or counselor. I'm just going to give you a few tips on that to see if that helps you a little bit. Okay. All right, so let's talk about format. The exam was changed in 2024. So if you don't know, it went from 250 questions to 225 questions. Only 180 are being scored. So there are 45 questions you will be answering that don't count. Doesn't matter if you get them right or wrong, they don't count. Why do they do that? 45 questions on the exam are used to determine if they're good questions to use on an exam in the future. So you won't know which 45 questions aren't being scored, because if you did, you would just skip them. And then they won't know, are they good items for a future exam or not. All the items on the NPTE are, they validate them. So they run statistics on them, they test them. And so this is part of that. Okay. The exam is 5 hours. That has not changed. It was 5 hours when it was 250 questions. It's still 5 hours. Okay. The way it's set up is there's 5 sections of 45 questions. So a section of 45 questions will come up. Section 1, questions 1 through 45. You can move around within those 45. So you can go, oh, I want to go back to question 20. You can do that. You can flag ones for review. You can go back, review, decide if you're going to change an answer. That's fine. But at some point, you have to say, I'm done with this set of 45. You have to lock them in. They go away. You cannot get back to them. And the other 45 come up. Okay. And you'll have 5 sections like that. Okay. Since the exam is 5 hours and there's 5 sections, you want to move at least 45 questions per hour. Okay. If you are taking longer for each section, by the time you get to the last section, you're not going to have enough time. Okay. You can move quicker. That's fine. But you don't want to go any slower than 45 questions per hour. There is a scheduled 15-minute break after section 2, which is after question 90. There will be 15-minute break. The clock on your computer will stop. We recommend you take that break, go out of the testing center into the lobby. You can't actually leave the center, but you can go into the lobby, go to the restroom, get something to eat out of your locker, wake yourself up, and then go back to take the other 3 sections. Big change in 2024, there are now scenario-based questions. There are up to 40 questions that are scenario-based, not 40 scenarios, 40 questions. So each scenario is going to have 2 to 5 questions associated with it. Okay, that's a new change from 2024. What have they added to the exam? They have added regenerative medicine for musculoskeletal and neuro. They've added telehealth, not like state laws and rules for telehealth, but just the concepts of telehealth. They have added interpretation of electrodiagnostic testing summaries. So if you were given the testing summary for a nerve conduction velocity test, do you know what that means? Okay. Or EMG tests. This one blows my mind. They have added gross motor development progression. I'm a peds therapist, and I'm like, wait a minute, they added that? Haven't they always had the gross motor milestones and progression on the exam? I don't know, but now they say they've added it. So now we know for sure that it's there. They've also added negative pressure wound therapy and vacuum assisted closure. What have they deleted? They deleted phonophoresis. Now, some people have said to me, oh, I heard they've also eliminated iontophoresis. I'm like, they never said ionto. They only said phono. I actually emailed the Federation and they said, no, ionto is still on. Phonophoresis is not. Videos. This is the other big change. There are now videos on the exam. The videos can be replayed. They can be stopped. They can be paused. What they suggest is when you get to a video question, on the bottom right-hand corner of the video will be a loop button, an arrow that looks like a loop. They're suggesting you hit that and let the video play over and over and over again as you're reading the question, as you're reading the answers, so you don't have to keep hitting play. You do not need sound. These are all visual, okay? And the videos on average at this point in time, they said it's about 6 to 9 seconds, okay? Content. The NPTE is 27% musculoskeletal, 24.5% neuro. So when students say to me, I don't know what my weaknesses are, I'm weak in everything, I don't know where to start, I'm like, well, do you know musculoskeletal neuro is over 50% of your exam? I would probably start there, okay? Cardiopulm is 14%. Lymphatics is 3.3. Other systems, I'm going to talk to you about what other systems here is in a minute, that's 17%. And then non-systems is everything, obviously, that's not a system of the body. So it's going to be your research, your professional roles and responsibilities, ethics, documentation, equipment, devices, modalities, prosthetics, orthotics. It's all that other stuff, okay? They break it down even further. 24.5% is going to be on examination. PT tests and measures, getting a history, doing a chart review. What is the normal developmental sequence? What is this primitive reflex? How do I test it? It'll be outcome tools. What is normal gait, normal joint biomechanics? All of that's an exam. The biggest part of your exam, though, here, 32%, is evaluation, differential diagnosis, and prognosis. Okay, you guys know what differential diagnosis is, right? I mean, that's probably a big part. You know what prognosis is. I think prognosis, sometimes we kind of like flip through. Like as you're studying pathologies for the NPTE, you need to stop yourself and say, is this a progressive disease? Is this not? Does this clear up really quickly? Am I going to have this person in rehab for, 6 weeks, or is this somebody that's going to be longer? What's the natural course of the condition? So you want to know that kind of depth for prognosis. Evaluation. A lot of students don't understand what's the difference between exam and eval. Okay, so I'm going to give you an example. If I give you a question and say, here's this scenario, which outcome tool would be best for this patient? And you pick the Berg, okay? That is an exam question. You pick the right exam tool or outcome tool. But if I change the question and say, you did the Berg and the patient scored a 40, what are you going to do? That's evaluation. Evaluation is, do you understand what the results of your test and measures mean? Well, somebody who gets a 40 on the Berg still means they're high risk for falls. And so then you have to pick an answer accordingly, okay? Intervention is almost 30% of the exam. It's still a big part of the exam. Equipment, devices, technology, modalities, 6%, safety professional roles, evidence-based practice, 8%. So they break it down even further. And it's not important, like, to know this in any detail, but I mean, if you are wondering, musculoskeletal is 27%. You're going to have about 50 questions. 16 are going to be probably on PT examination, 16 on differential diagnosis prognosis, 17 on intervention, okay? But look at lymphatics. You're going to have 1 on exam, 2 on differential diagnosis, probably 3 on interventions, about 6 questions, okay? Why do I want my students to understand the content outline? Because your study plan should reflect this, okay? You do not want to spend a huge amount of time on lymphatics when it's 6 questions. So I make all my students write study plans. And I had a student once say, I'm going to do musculoskeletal for a week, neuro for a week, cardiopulm for a week, lymphatics for a week. I'm like, that makes no sense. You should do musculoskeletal for 2 weeks and lymphatics maybe 1 day. Okay. So keep this in mind when we get to the study plan. I'll show you how I use this in writing a study plan. These are the other systems. I told you I would get to that. That 17% piece of the pie is integumentary, metabolic, endocrine, GI, GU, and systems interactions. That makes up that 17%. These are kind of small in themselves, but you put them together, 17%, it's bigger than the cardiopulm, right? So integumentary, about 9 questions. Metabolic and endocrine, there's not going to be any PT examination questions. These are all differential diagnosis, prognosis, intervention. What you should hit hard here, obviously, is diabetes, okay? GI and GU, 8 questions. Systems interactions, look at that. There's no PT exam questions. There's no intervention questions. So what is systems interactions? It's any pathology, condition, treatment that affects or can affect multiple systems. So let's think about that. What pathology could affect multiple systems? Diabetes, okay? Cancer. What condition can affect multiple systems? Obesity, pregnancy, schizophrenia, depression. So systems interactions is where you're going to find the pregnancy questions, the psychiatric questions, but it's anything that can affect more than one system. So if you purchase our review and study guide, we have a chapter on systems interactions, and we make sure that we show you and what can show up in that area. Because they're only differential diagnosis, prognosis, and evaluation, they're going to say, okay, this patient came in and they've been diagnosed with diabetes and they're presenting with this, and this. What are you going to do? And it's looking to see if you know that's part of diabetes or it's not. Okay, because it affects multiple systems. Equipment, devices, technologies is 6%. You're only going to have 6 questions on equipment, devices, and technology. Think about this. How long could you spend on just prosthetics? A long time. Add in AFOs, wheelchairs, assisted devices, okay? That's what's in those 6 questions. So yes, you want to study prosthetics. You want to study AFOs and FOs, but you want to budget your time because it's only going to be 6 questions. Modalities, they have decreased the number of modality questions. You're probably only going to have 5. 5. So yeah, you need to review ultrasound, E-stim, your modalities, but again, we don't want to spend a huge amount of time there, okay? Safety and protection is about 6 questions. Do you understand lines and tubes? Do you understand body mechanics? Do you understand universal precautions? Okay, 6 questions. Professional responsibilities, 4 questions. Primarily, they're questions about, do you understand the difference between a PT's role and a PTA's role? Again, not state laws and rules, but what is the basic differences about how a PT and a PTA should function? And then evidence-based practice, research, only 4 questions. I have students that say, oh my gosh, I'm not good with all that research stuff and stats, and I need to spend a huge amount of time on that as I'm studying for the NPTE. No, you want to study it, but we're not going to spend a huge amount of time for 4 questions. If your weakness is musculoskeletal, spend your time there when there's 50 questions and budget your time with research with only 4. All right, the format of the NPTE. All questions will have 4 answers. There won't be 3, there won't be 5, only 4. You will see they do not use all the above, none of the above, A and B, B and C, none of that. There'll be 4 separate, discrete, plausible answers. They don't make up anything that doesn't actually exist. Okay, so if you're reading something and one of the answers is the hokey pokey test, then the hokey pokey test is a real test, which it's actually not. I'm just saying that they won't make up something unless it really is truly exists, right? Because they're not trying to confuse you or trick you in any way, okay? So they're plausible. They will bold and capitalize some keywords like what's the best thing, the first thing, the least likely, because they don't want you to miss that. Okay, but obviously they're not going to capitalize and bold every keyword. Okay, just those types of keywords. There is a cross out feature. If you know an answer is incorrect, you can cross it out. I suggest that. Like if you're reading a question and you're like, oh my gosh, I know this is wrong, cross it out. That way, if you come back to review that question, you don't even have to look at that answer. Okay, so that's up to you, but you have that feature. You also have a highlighting feature. And I'll talk about this later, like who should use this and who shouldn't, but you do have that feature and you can highlight any words in the questions and answers that you would like. They use minimal abbreviations. They do not want to trick you. They want you to understand the question and they want to evaluate your knowledge. Okay, so if you do not have the NPTE candidate handbook, I would go on to the FSBPT's website and download it. In the back of that handbook is a list of the abbreviations they are allowed to use, and those are the only ones that items writers are allowed to use. There's 50. When you look through them, it'll make you feel better because you're going to be like, okay, I know what C1 and C2 and C3 are, right? Or I know what CVA means, but you should look at that, okay? And it'll make you feel better. This is really important, okay? For standalone multiple choice questions. So I'm not talking about the questions associated with the scenario. That's different. The standalone multiple choice questions is going to be the majority of the exam, 140 out of 180 at least, if not more, okay? This is important. They do not allow item writers in the stem of the question to add an age, a gender, an ethnicity, a religion, a setting, a time frame, unless it matters. So on your standalone multiple choice questions, you need to read every word in that question. And if they give you an age, you should highlight that. Oh, they gave me an age. There's a reason for that. Oh, they gave me a lab value. Oh, they gave me a manual muscle test score or a range of motion score. You can't gloss over that because they won't add anything to the question that doesn't matter. Okay. Now, scenarios. There's been some people who haven't been happy with the NPTE. Why are you giving them questions and you're only giving them the information they need to know to answer it? Our patients don't come to us with that. Well, they've corrected that. So now there are scenario-based questions. The scenarios will give you an age, a gender, a time frame, a setting. And now you have to decide, is that relevant to me answering these questions or irrelevant to answering these questions? Okay. So that's an important thing to know. There are different levels of complexity. So they discourage item writers from doing straight knowledge questions. Very, very unlikely you're going to see a question about what's the origin and insertion of this muscle. No. Okay. They really want item writers to write application. I know the knowledge, and based on this clinical situation, I'm going to apply that knowledge appropriately. That's pretty much what you're going to see. There will also be some high-level synthesis analysis questions where you have to know multiple pieces of information to figure out how they fit together to answer that question. Okay, so do understand this, because as you're studying, I've had students say to me, if I memorize all the facts in the review books, I'll be fine, right? No, because your questions won't be fact-based. You have to understand those facts so you can apply it, okay? If you have not done the NPTE sample mini exam, I would highly suggest that you do that. Just get on FSBPT's website and search sample mini exam or put it in Google and it'll come up. There's a mini exam for PT and PTA. I would take both. Why? Why not? Right? And there are video questions in both. There are scenario questions in both. It also gives you the same tutorial that you'll be taking on test day. So take it ahead of time. On test day, when you're, anxious and you're getting ready to start, you don't want to read through, well, how do I mark questions for review? And how do I use the highlighting feature? Learn that ahead of time. And then on the day of the test, you can still go through the tutorial, but if you're not thinking too clearly, you already know, okay? When you go to take these mini tests, of course, students want to know, did I get it right? The question's right. The answers are on the homepage. Okay, so when you go to log in, right below that, you'll see the answer to question 1 is A, the answer to question 2 is C, or whatever. So you do have the answers. All right, questions on that? You can put something in chat or unmute. Okay, let's keep going. Let's talk about study plan. We recommend at least 8 to 12 weeks, depending on how much time you have weekly to put into studying. We want you to make a list of priorities. What are your strengths and what are your weaknesses? I have students that say, I don't know. I'm like, well, I mean, you should have an idea, but if you don't know, take a practice test. So some students will say, can I just start with a practice test and see where I'm at? Sure, do that and see where you're weak and where you're strong, okay? Start with your strong areas on your study plan. Now, students don't want to start with their weak areas. Oh, I don't like my weak areas. I'd rather study the stuff I like and I know. You don't want to do that. Well, I don't want to start with my weak areas because if I start with my weak areas and then 10 weeks later, I'll forgotten that. No, because you're going to have a review session every week where you're reviewing your weaknesses. So if you start with your weaknesses and you're reviewing them every week, by the time the test comes, those are no longer your weaknesses. They're probably actually your strengths. Okay, so start with your weaknesses. Do knowledge checks. Okay, I studied all my musculoskeletal. Let me take some questions. Let me do a mini exam of nothing but musculoskeletal. Let me see if I got it. Let me see how I'm doing. Okay. You want to do that throughout. But at some point, you do want to take full practice exams. We recommend 3 to 4. Okay. I have students, they take 2 or 3, they're passing, they're doing well. I'm probably like, you don't need a 4th. If I have somebody who's not passing yet, their scores are increasing, but they're not there yet, I'm like, take another one. Let's see how you do. Let's see if you can get to that point. That'll give you confidence, okay? People that are struggling with timing. I'm struggling to get the exam done in 5 hours. Usually the more practice tests are helpful to get the timing down, okay? Your study plan should have that review session every week, okay, for repetition. I suggest you have study group sessions built into your study plan as well. And we'll talk about that in a little bit. Make sure you cover all the content. Yes, lymphatics is only 3%. It's only 6 questions. However, I've seen people fail by a very small amount, 1 or 2 questions. So what you want to do is get through your entire review book and cover all the material, because it may be that one lymphatic question that gets you to that 600, which is passing. Oops. Make the plan yours. I'm going to share with you my study plan. You can take it and you can use it, but it may not fit you. And so it's good if you can kind of redo that plan to fit you. Okay. I gave you guys my email on the beginning slide. I bet you nobody wrote it down. So I'm going to put it in chat. It will also show up on my last slide. But if you like the study plans I show you tonight and you're like, gosh, I really wish I had that in Word, email me and I'll send it to you. Okay. However, I do want you to collaborate with others. So if you have a study group of 3 people and you're like, yeah, we're going to study together, we're going to group study. What do you think about our study plans being the same? That's great. As long as you consider everybody's strengths and weaknesses, but you can do that. Yes. Okay. So what we have found, we've asked students, okay, hey, you passed the exam. That's awesome. Can you tell us how much time you spent studying? The average student has told us they studied 3 hours a day, 6 days a week for 6 weeks. Now that doesn't work for everybody. And so what I tell people is, don't worry so much about that. Just understand, I did the math. It's 108 hours. So I recommend your study plan is at least 108 hours. If that's what the average student needed to pass, then why not make your study plan 108 hours? That does not include practice exams though. So you're going to have to find room for that 3 to 4 practice exams, and you need to find room or time to review the exams. Okay. So I had a hard time putting all of that into 6 weeks. So I have 2 study plans. I have an 8-week and a 12-week, and I'm going to show you those. Study by topic. Okay. It doesn't have to be MSK. I don't like musculoskeletal. If you told me I had to spend 2.5 weeks on musculoskeletal, I'd be like, no, right? But it's my weakness. So I need to start there. Okay. But I think what I'm going to do is study the knee. And then I think I'm going to go study that lymphatics. And then I'm going to come back and study the shoulder. And then I'm going to do integumentary. I'm probably going to have to break it up, but you do want to complete whatever it is you're studying before you move on. So if you're going to study wound care dressings, study it and finish it. If you keep bebopping around and you haven't really finished anything, it's going to build your anxiety. You're going to feel like you haven't accomplished anything. So no matter how small or big the topic you decide, finish it before you move on. Okay. Integrate sources. There's review books. You have textbooks. You have classmates. You have faculty. You have therapy ed. You have me. Use all your resources. I'm going to give you an example. I was meeting with a student once. She didn't pass the exam. And we were talking about integumentary. And she said, what's a wet to dry dressing? And so I told her, and she's like, oh my goodness, I kept seeing that show up on the exam. I just assumed it was right all the time. So I just kept picking it. And I'm like, no, you do not want to pick that answer. It's going to be wrong all the time. But she didn't know what it was, but she didn't bother to go look it up. Integrate your sources. If there's something you don't understand, learn about it. Don't assume it's not going to show up. Okay. Use your practice exams for diagnostic purposes. How am I doing? Are my scores increasing? Are my weaknesses, going up? Don't use practice exams to solely study. I've had students do that. Not a good thing to do. When you take your practice exams, do it in the 4 to 5 hours. Somebody said, how do I work on endurance? This is one of the ways. Simulate the environment of the NPTE. I would go to the library, get a private room, turn off my phone, not have food sitting out. I would simulate the NPTE and I would do the 4 to 5 hours. I say 4 hours because some practice exams aren't 225 questions. Ours are. So for therapy ed, you would want 5 hours. For Peach, you want 5 hours. After section 2, I would take that 15-minute break. I would simulate it. And that's one of the ways you can work on endurance. While I'm thinking about it, because somebody had that question at the beginning. Some people, when they write their study plan, they purposely do blocks of 4 to 5 hours with a 15-minute break to do their study sessions like the NPTE to also work on endurance. My only, and I think that's fine if that works for you. My only trepidation is if you can't maintain, you really can't maintain focus for 4 to 5 hours, you're wasting some of that study time. Okay, but maybe you can work up to that. Review your practice exams. I used to tell people, yeah, when you review your practice exams, review all the questions you got wrong, clearly. But now what I tell people is, if you can find the time, review the entire exam. Why? Sometimes you were guessing and you got it right. If you go back and review it, you'll be like, oh yeah, man, I was guessing, but you know what? I got it right. Let me read the rationale. Oh yeah, that's what I was thinking. Or, oh, I got it right. I was guessing, but that's not what I was thinking, right? Because the content's going to show up again. The more practice exams you take, the more you see the same content show up again and again and again. So if that content shows up on the NPTE, you're not going to be guessing. You're going to have more confidence in answering that question. So Therapy Ed has this 6-week plan. They say start with your weaknesses for 1.5 weeks, take a practice exam, do another weak area or a large content area for a week and a half, take another one. Do you need to refine your study plan? Continue, take another one. You have 1 week left. Okay, take your 4th one, make some plans for final studying. You could do this. But again, I had a hard time fitting everything in to a 6-week plan. And I think most students would say the same. Okay, so I'm going to go and show you my 8-week plan. All right, so here's my 8-week plan. So let me walk you through it. How did I figure out how much time you should spend? Well, remember what I said, the average student needs 108 hours to pass the licensure exam. Well, musculoskeletal is 28% of the exam. So what's 28% of 108 hours? It's 30 hours. So I just did the calculation. I said, if the average amount of time a student needs is this, and this is the percentage on the NPTE, how does that equate? So you can see that on the bottom right hand of your screen, I did those calculations. Okay, now your job, how you make it your own, is you might say, you know what? I rock musculoskeletal. I'm passing it on every practice exam I've taken, or, you know, I just know I rock it. I don't need 30 hours. I'm going to decrease that to 20, but I'm going to add 10 more hours to neuro. Okay, so you can follow this as is or make it your own. Now, how did you decide what goes first, second, third, fourth? You want to start with your weaknesses. So if musculoskeletal is not your weakness, move it down. Okay, maybe cardiopulmon's your weakest area. Move that up to week 1. Okay, so I want you to make it your own. For the student who tells me I'm weak in everything, I don't know where to start, I tell them to do this because I put musculoskeletal first because it's the biggest part. I put neuro second because it's the second biggest part. So I organize this again based on the content outline and the percentage of questions. As you can see, every Saturday, I have a review. 1 hour might be okay in the beginning, but by week 3, 4, that might actually have to be 2 hours. By week 5, 6, 7, those might have to be 3 hours. Why? Because those review sessions are supposed to be accumulative. So let's look at week 4. Week 4, that review session should be reviewing your musculoskeletal, your neuro, and the 2 days of cardiovascular that you did. Okay, that's how you get repetition in. I started with musculoskeletal because that's my weakness. I am going to review musculoskeletal every Saturday for the next 7 weeks. Okay, getting that repetition in so I know it. And then as I study new content, I'm going to add it. And we'll talk in a minute about how you're going to do that, because you might be like, oh my God, how am I going to do that? I'm going to tell you how to do that. Okay. The other thing you see here is numbers. You see CM with page numbers, and you see SG with page numbers. Okay, what is that? So CM is the Therapy Ed course manual. If you take our 2-day course, you get a course manual. Those are the page numbers. SG is our study guide. If you've purchased our review book, our big review book, which anybody can purchase, those are the page numbers. So what I've had students tell me, you know what works really well? When you take the chapters and you know you're going to be studying musculoskeletal for, what do I have here, 9 days? If you divvy up the page numbers. So I'm going to get through so many pages every night so that I know by day 9, I'll have gotten through both chapters in both books, and I will stay on track. So that's what those are. So this 8-week study plan works well when you're not in school and on a clinical. Because I know some of you right now are probably on clinical, you're going to take it in October, or you're going to be taking it in January, but you're on clinical this fall. And you might be saying, there's no way I can go home from a clinic day every night and do 3 hours of studying. Yeah, you can't. So what I recommend is a 12-week plan. The 12-week plan is you doing your practice exams on the weekends and doing most of your studying on the weekend, but just devoting 1 hour a night, Monday through Friday. Again, you might be on your clinical and you might be like, well, I have every Friday off because I'm working 4/10s. Then shift it, right? So make the study plan to fit what you need, to what's going to work for you, okay? Do develop a study plan. Think about it. If you don't have a study plan, you're just kind of flying by the seat of your pants. Having a study plan, checking things off, finishing it will decrease your anxiety. So get a calendar, an Excel spreadsheet, a Word document, whatever, start plugging stuff in. Mark off the days you can't study. Figure out which days you can. Figure out which days you can take those practice exams, remembering you need several hours. Schedule that to review each exam, okay? What about group studying? I suggest that review every week is with your group. That would be great. Okay, can you fit 108 hours of studying into the 8 weeks or 9 weeks or 10 weeks? If not, because of everything going on in your life, you're going to have to move your start time back. Okay. Questions about study plan? I know a lot of people had questions about that. There might be some lingering questions about, well, how do I actually study? That's what I'm going to get into right now.
I actually do have a question. I'm sorry.
Yeah, go.
Talking about like how we're supposed to review every section every single week. Are you going to get into that or should I?
Yes.
Okay.
Yep.
Then I'll wait.
Yep.
All right. Thank you.
Yeah. And that's a great question because people are like, what? All right. So let's look at best practices for studying. Know your goal. Oh, yeah. Go ahead.
Sorry, really quick.
Yeah.
For the course manual and the study guide page numbers that you put, is that for the paperback, like the paper book or the ebook, or do those pages line up with the ebook?
They should line up.
Okay.
They should line up. What I showed on the screen might not be the current page numbers, but if you email me and I send it to you, I had my GA update the page numbers.
Okay.
Yeah.
Because I was referring to an old one. I think it was an old one that I got from one of the therapy ed in-person course.
Okay.
And it wasn't lining up exactly. So I was just kind of going.
Yeah. You know, we update our course manual every 5 to 10 years. We update the review and study guide every year. So sometimes the page numbers don't match. That's why every year I have my GA go in and match up all the page numbers with my study plan again. However, if you're looking at my study plan, which is 2024, but you have the 2023 book, it shouldn't be too hugely off. And it's easy for you to kind of do that yourself and just say, okay, musculoskeletal is this many chapters, or this many pages, let me divvy up the page numbers. So, but yeah, it might be a little off.
Got it. Thank you.
Yeah. Study session, know the goal of the session, right? So I'm studying the knee today. I'm studying wound care dressings. I'm studying primitive reflexes, whatever the goal is, or I'm studying these page numbers today. Okay. Review books are great because they're guiding your studying. They're helping you stick to entry level knowledge, and they're giving you the stuff that's most likely going to show up on the exam. Okay, so I think that's great. Use your review book. If there's something you still don't understand, then you can go look it up. But they really help you like focus in to things. Okay. Studying. Research has shown reading and rereading does not help learning. Thank goodness, because I am a slow reader. I hate to read. Okay. So I don't want to, that would be bad for me if they said, oh yeah, reading that chapter 10 times is what helps learning. No, no. What they say helps learning is constant quizzing and questioning the content and being able to apply it is what helps with learning. Okay. So this is what I suggest as you're going through your review book. If you know it, if you read something and you're like, I know that, leave it in the book. Okay. I know that. I don't need to worry about it. I know that. Okay. Leave it. If you read something and you're like, oh, I know that, but I'm afraid I'm going to forget that, highlight it. Highlight it in the book. Okay. Then when you get to something and you're like, okay, this is something I really don't understand. That's what you take out and put on a study guide. Okay. So follow my thinking here. I've had students who do these very elaborate, very long study guides. What they end up doing is rewriting both books. That is a waste of your time. Do not do that. If I know it, I'm going to leave it in the book. If I know it, but I'm afraid I'm going to forget it, I'm going to highlight it. And if I'm really struggling with this, I'm going to pull it out and put it on a study guide. Okay. Then what do you do on the days you're going to review? Hand your book over to somebody and say, quiz me on everything I highlighted in chapter 2. And they're going to go through and quiz you on that. And the more they quiz you week after week, the more you're going to know it. Okay. And you can even start checking some stuff off. You know what? I know that now. Put a check by it. We're not going to cover that again. Okay. Spend some, and this doesn't even have to be your group. It could be mom, dad, boyfriend, whoever. They don't have to be a PT. Quiz me on the stuff I highlighted in the book. Okay. Then with your study group, though, I would go over those study guides. This is something I really don't understand. I have questions. Can somebody explain it to me? Okay, and to get that part of it. Okay. So hopefully that answers a little bit about what you're going to do on the reviews. As the reviews go on and you're adding material, you're also getting faster with the stuff you've already reviewed, and you're probably checking some stuff off that you don't need to review anymore. And so, yes, they will accumulate, but yet you're going to get faster, and some of the stuff you're not going to have to review anymore. Really quick, I don't want to get too much in the weeds with different types of critical reasoning, but remember they do all different types of difficulty and complexity of questions. So I just want to go through this really quickly, not for you to say, oh, when I'm reading a question, I need to identify if it's an analytical reasoning or inferential reasoning. No, that doesn't matter. What I want you to take away from this is, how do you study? Okay. Analytical questions are the kind of questions that give you all the signs and symptoms. The patient presents with this. What pathology is most likely? If you struggle with those, develop a table where you're comparing and contrasting the pathologies. For example, I had a student of mine who said, Suzanne, all the cardiac pathologies sound the same to me. I can't answer these questions. Okay, make a table. Here's the common cardiac pathologies. These are the signs and symptoms. These are the lab values. These are the ECGs. Compare and contrast in a table that information. Okay, and then have somebody start quizzing you on it, and you'll be able to answer these analytical type questions. Inductive and deductive, I'm going to kind of put them together. Inductive is when you know something really specific, like, oh, I know this exercise is really good for somebody with a rotator cuff injury. Okay, that's knowing something very specific. But if you're able to say, yeah, you know, that I understand how that exercise is great with that patient, but you know what, this exercise would also be great with this patient and this patient and this patient. That's inductive reasoning, knowing something very specific, but being able to apply it to other situations appropriately. Deductive is the opposite. Deductive is when you have these general concepts, but you can apply it to a specific patient. So my example is, let's say you learned about aquatic therapy and you got all these general concepts. Okay, great. But you're really good at deductive if you're like, okay, I understand aquatics. Aquatics would be perfect for this patient with fibromyalgia. Okay, so when you're studying, how do you get to this? Make sure you are always asking yourself or asking your group, who else would we do this with? Who else would present this way? Who else would have this finding? Who would not? Why? Why wouldn't we want to do this with this person, that person? So just be always asking yourself questions. Inferential questions are, how does the typical patient present? So if I give you a question and say, patient came in and they have multiple sclerosis, which of the following would be the best treatment approach? I shouldn't have to tell you that people with MS, their biggest concern or issue is typically fatigue. I shouldn't have to tell you that. You should know it because you should know the typical presentation of a patient. And so on the exam, they're going to rely on you knowing that to be able to answer some questions. They don't have to tell you the person with MS has fatigue. So as you're studying, be thinking about that. And your group can quiz you on it. What is the person typically with Guillain-Barré? How would they present? How would this person typically present with this? And that might also go back to the tables you're making for the analytical reasoning. Evaluative reading, I think people do well on these. These are ethical decision-making questions. They're given a dilemma, what would be best for the patient. And so, if you don't do well with those types of questions when you're taking practice exams, I tell people, go back to your ethical decision-making models, that type of stuff. Group studying is extremely valuable. Why? There's more knowledge in a group than you by yourself. Groups stimulate creativity, problem solving. Students retain more information from group studying. Students come away with a deeper knowledge base and they have greater satisfaction. They feel supported. Okay, why do people not like to group study? I know why. Group studying makes me anxious. I don't like to hear that people know things that I don't know. Okay, we're going to talk about how to manage that. Group studying, I don't like to group study because my group gets off topic. It's a waste of my time. Okay, I'm going to talk to you about how to do that too. Group studying is so valuable. If you can figure it out, I would do it. Ideal size is 3 to 5. So if you have, it's just going to be you and one other person, see if you can invite one more. Okay. If you have 6 people, don't vote somebody off the island. Keep 6. But if your study group's 10, no, it's too big. Okay. How do you manage the anxiety? Just decide with your study group what you're going to cover when you get together. Study it on your own first. That should decrease your anxiety. When you get to that study session and you are able to contribute, you're able to teach something, you understand something, that is going to help your confidence. If there's a few things here and there you don't understand, don't let that increase your anxiety. Say, I'm glad I'm here because now I know it. Okay. And they explained, and maybe I didn't understand something, and they explained it to me in a way that now I completely understand it, and I'm not going to forget it. That's a great thing. Okay. So agree what to do. If you don't have a good study group, find another one. Okay. If you don't have a good study group, it's still good to change it up from time to time. Always be asking questions. Get to all those types of critical reasoning. Just don't memorize the facts. If you can teach the group something, teach it. That way you know it when you can teach it. That'll make you feel good. Efficiency. Got to set some ground rules with your group. We're going to meet. So this is this technique down here. We're going to pick a task. We are going to study wound care dressings for the next 15 minutes. We're going to set a timer. We cannot talk about anything else. Wound care dressings, 15 minutes. The timer is going to go off. We have a 5-minute break. Let's go get coffee. Let's go to the bathroom. Let's talk about our weekend, whatever. Timer goes off. Next 15 minutes, we're now studying whatever. Okay. That's, if you can develop that, agree on your ground rules for your group and stick to that, you can be very efficient. Actually, study groups can actually increase your efficiency. Think about this. If you're, I know you you've done this. Have you ever been studying on your own and you're like, oh, I don't understand that. I better go look it up. And an hour later, you figure it out, right? Or you don't even figure it out. But if you asked your group and they're like, oh yeah, I understand that, and they tell you, boom, it's done. So it can actually be more efficient. Yes, I do have a lot of people who come onto the online office hours who don't have a group to study with. And I have people that email me too. So I always tell people, come onto our online office hours and put in the chat that you are looking for a group to study with. That's the best thing. And so somebody did that in chat already. So if you're somebody else that's looking for somebody, you know, exchange emails with each other or whatever, get hooked up. You can study on Zoom together every week. So try and do that. Yeah, Mark.
Hi, how's it going? I just had a question for you. I've heard a lot of students when they take the MBT that they'll walk out of the room feeling like they failed it.
Yes.
I wanted to get your opinion on why you think that that's the case with a lot of students when they leave the exam.
Yep. I took my PCS exam and walked out and called my husband and said, I failed.
Yeah.
And I didn't, because the test is difficult. And a lot of students will get it down to 2 answers. And they, you know, and sometimes they're just not sure, is that the right answer or not? And they do. What I would tell you is, you may feel like that when you walk out. The best you can, put it out of your head, because you don't know if you did or you didn't. But it is an exam that you do have to pick the best answer. And a lot of students will get it down to 2 and they're not sure, like, did I pick the right one? Did I not? Some people, I mean, there's a whole host of reasons too why people don't pass. Some people don't finish it on time. Some people have to hurry. Some people second guess, which we're going to talk about. They go back and change a lot of answers without a good reason to do so. And those things increase anxiety. And then when they get out, they're like, I don't know if I passed or not. I would say the majority of students feel that way. There are some students who walk out who are pretty sure they passed. And they're probably the students who have taken practice exams, they're passing the practice exams, and the NPTE, they're seeing the content showing up again, and they're just feeling a little bit more confident. And they may walk out and say, yeah, I think I passed. But the majority are going to say, I don't know. I don't know. So I don't know if that answers your question. It's just the way that yeah, go ahead.
Yeah, do you think like exams like the PEAT are a good reflection on like
Yes.
taking
The
that
PEAT,
and preparing? Yeah.
yes, the PEAT are the best, specifically the retired PEATs. So if your program is buying you 2 PEAT exams, the retired one's the best one, because all those questions were validated. The practice one's still good, but those questions weren't validated. I'm told therapy ed exams are the second best. So people have told me, many people have told me therapy ed and the PEAT is the way to go. So yes. Okay.
Can I
Yeah.
ask a question?
Sure.
Sorry. I just wanted to know if you've noticed or what your thoughts are about signing up for multiple different prep companies and what you've seen.
So some people will take the therapy ed course, but they'll get the Score Builders book, but they'll sign up for Final Frontier. So my advice is, first of all, are you going to be able to do all that? And most students cannot. So you have to look at how much is it costing? How much time do I need to put in? Can I do this? Okay. If you take the therapy ed, our 2-day course, I highly recommend you have our review and study guide, because we refer to that so much and give you so much information from it. I will have students that say, well, I'm taking the therapy ed course, so I decided I would get the Score Builders book. We don't actually recommend that. Some people will get therapy ed and Score Builders. They'll have both books. That's fine, but are you going to be able to make it through both? Most people struggle to get through one. So I don't know if that's answering your question, but
I think you are. It sounds to me like pick
yeah.
my time and then, go accordingly.
Yeah, look at each thing and what people have to offer. Final Frontier, I think it's good for people who need somebody to give them a study plan and tell them what to do every week and, you know, give them assignments and stuff like that. Some students say that it helps me be accountable. Okay, I'm like being accountable to somebody. But I've also heard from a lot of students who say they can't get through it. It's too much. We are developing right now modules to have something similar, but we just haven't rolled it out yet.
Okay.
So I think it's good for some people. I've heard a lot of people who buy it don't finish it, or, you know, and end up giving it to somebody else. Or so I think you just have to look at what do you need. If you're somebody that's like, okay, I'm going to write this study plan. I've got a group that's going to keep me accountable. I'm going to keep myself accountable. I'm a great adult learner. You probably don't need somebody telling you what to do every week. If you do decide to do Final Frontier, they use our review book. So you're going to need the therapy ed review book.
Either way.
Because their readings are from our book primarily.
Okay. And then I'm a student that's in clinical, so that's like also kind of something I'm keeping in the back of my head in terms of like, does the Final Frontier, I don't know if you can answer this, like, does it give you a certain amount of time, or like does therapy ed give you like a certain amount of time? Like, I don't know if I'm asking my question right. Like, I want to study for an hour, right? Do you guys give like, I don't know if I should say estimated time to get through a certain section? Like, is that a thing, or it's
No, I mean, if you see my study plan, I'm like, get through these, you know, these pages in this amount of time. That's what we have.
okay.
Final Frontier, I've seen their study plan. So it's just like week 1, you're going to read this, you're going to do this, you're going to do that, you're going to do these questions. Week 2, you're going to do this, do that. I don't know how much time each week takes. I think that's a great question for them. I've just heard from some of my students, they've not been able to finish what's required every week.
Okay.
So,
Thank you.
yeah. But I've had students that what they could get through they thought was helpful. So
Okay.
yeah, I think just look at what fits you.
Okay.
I would just not start buying a bunch of stuff, and because you got to think about what's going to work for you and where to spend your money, right? And there are some review companies that are very expensive. I would stay away from those at this point in time. Now, if somebody's taken the exam 3 or 4 times and they've failed and they only have like 2 attempts left, then I might suggest that. But I had a student of mine who took a review course and it was like $1,200. He's like, it was great. I would recommend it to everybody. I'm like, no, I am not recommending that to everybody. It's just too expensive. Most people pass the first time without that.
Okay.
So, all right. I'm probably gonna run, it's 8 o'clock. I'm gonna run over, but I'm gonna keep going. If you have to log off, you can. It's being recorded. It'll go on YouTube tomorrow. Test taking tips. Read the STEM well. One word will mess up your understanding. What are they asking you, right? What is the question asking you? Again, use the highlighting feature. Highlight words if you're a fast test taker. Use the highlighting feature if you're a fast test taker. It makes you slow down. It makes you read every word because you're deciding what to highlight. Fast test takers often miss keywords. If you are a slow test taker, you may not want to use the highlighting feature on every question. I would use it on the questions that you're struggling with, that you know you're going to come back and review. So when you come back, you don't miss that keyword. Read all the answer choices, obviously. Don't just pick the first one that looks good. Most people do get it down to 2 answers. But if you're looking at a question, you're like, I have no idea. Just don't pick from 4. Use some of the strategies I go over, try and get it down to 2. If you can get it down to 2, it's very likely one of those is the right answer. Now you have a 50-50 chance of getting it right versus a 25% chance. Cross out answers if you know they're not right, like incorrect. We already talked about that. A lot of students tell me what they do is they read the question, they highlight the keywords, they look to see what the question is asking. They read all 4 answers. They cross out the answer they know is wrong. They pick the answer. Then they go back and they read the question a second time. Make sure they didn't miss anything. Make sure they understand what's being asked. They verify their answer. And then they make the decision, do I check this one for review or am I good? Okay. So I had a student who did that for every single question. And she said, even if it seemed like it was an easy question, and she said, I would pick up errors every once in a while, even though I thought it was an easy question. So I thought that's a good thing. Can anybody sign up for the 2-day online prep course? Yes. Yep. Yep. Okay. Your priority on the exam is always, what is physiologically best for this patient's body? What is the safest thing? That is your first priority always. So you don't want to pick the answer that's financial, social, emotional, even functional. We're all about function, 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 function. But if there's an answer that's like, you know what, I need to do this first because this is the best thing for their body. This is the safest thing. That's where you want to go first. Okay. And the whole mission of the FSBPT is to make sure you're going to be safe. So that's the whole purpose of the exam. Don't add extraneous information. Are you this person? You read it and you go, well, maybe they have stairs at home. Maybe they don't. Maybe they live alone. Maybe they don't. So if you're that kind of person, you got to stop doing that. So what you need to do is say to yourself, wait a minute, could the opposite be true? The opposite could be true. I got to get rid of it. Okay. That's different than, oh, they have MS. They probably have fatigue. You can do that because that's using your inferential reasoning, your knowledge base. That's fine. But doing this, well, maybe they drive, maybe they don't, get it out. It's just going to mess you up. Okay. And some students do that. Changing answers. We do highly suggest you mark questions for review. We suggest if you have time, you do go back and review the ones you marked. But if you still say to yourself, I still don't know, do not change your answer. You have to be very diligent about this, okay? Because you're just second guessing yourself. Typically, your first answer is the best. If you just willy-nilly start changing answers because you're second guessing yourself, it's going to increase your anxiety, okay? But if you go back and you say, oh my gosh, I get it now. Oh, I missed that keyword. Oh, that was a mistake. Now I understand. The light bulb goes off, then change your answer, okay? Research shows if you stick to this strategy, you will actually change from the wrong answer to the right answer by approximately 3 to 1, okay? So if you go back, you still don't know, leave it alone. You go back and you're like, oh, I get it now. I messed up. Change it, okay? Slow test taker, you're gonna have to work on it, okay? It's a minute and 30 seconds per question on average, okay? Fast test taker, is that a problem? Maybe, maybe not. If you take a practice exam and you go back and you review it and you say, oh, why did I do that? That was silly. Oh, that was a dumb mistake. Oh, I missed that keyword. Oh, I didn't see that they were a young person or an older person. You're going too fast. Okay, start using that highlighting feature on every question. Make sure you analyze your practice exams. Again, review all the questions if you have time. But ask yourself, why did I miss that question? Was I didn't know the information? Okay, I'm going to go study it now. I'm going to go look it up. I'm going to ask my group. Maybe I understood it. I didn't apply it appropriately. Why? What did you miss in the question that didn't have you applying it appropriately? Okay. Did you miss keywords? Were you reading too fast? Okay. Or were you going back and second guessing and changing your answers even though you didn't have a really good reason to do so? So you will get two whiteboards when you take the exam. During COVID, they gave people paper. I'm told they're back to dry erase boards. Christine, was that your question? So I see you raised your hand too. Yep. Okay. Yeah, you get two dry erase boards. So you can write things down. Are you adding extraneous information? Oh, maybe they have stairs at home. Maybe they don't. Okay. Do you recommend, using the dry erase board? Only when you need to, right? You don't want to write every stuff down for every single question. It will slow you down. Some people, you're not allowed to write anything down until the exam starts. When it starts, you can write whatever you want down. So some people tell me they just have a few things in their head, like at the very beginning, they just want to put down on the dry erase board. It makes them feel better. If that question about sensitivity and specificity comes up, I've got my answer right there. Okay. But you don't want to spend a lot of time doing that. You just want to use the dry erase board when you need to. Yeah, you can't write everything down. It really will slow you down. Do you have to erase after each section? No. Nope. Yeah, once the exam starts, you can write whatever you want down. Nobody's monitoring. You should be fine.
Are we not allowed to ask for paper?
You could ask at the testing center. They may say, no, we do dry erase boards. Some might allow you to have paper. They're going to make sure that they collect it. The reason they don't like paper is because they don't want you to sneak it out. You can't really sneak out a whiteboard. So my understanding is they're going to want you to use a whiteboard, but you could ask when you get there, why not? But they might tell you no.
Okay.
Okay, so you want to go through and analyze your exam, how am I doing? I want to show you. So I deal with this a lot. I have students that contact me and say, I'm 2 weeks out and I'm freaking out. And I'll say, okay. And we talk about it. And one of the things they're freaking out about is they haven't passed an exam yet or a certain section. But the problem is a lot of times they're looking at stuff they haven't even studied yet. So I'm like, let's just look at the scores, the stuff you've studied. Is that going up? Is your overall score going up? If you still haven't studied lymphatics and you're still not passing it, that's fine. Once you study it, then hopefully your scores will be passing. Okay. What I highly recommend is you log all of your scores on an Excel spreadsheet or something and look for patterns. And so what I want to do is just get to this. Okay. This is one of my students. So their practice Pete, they logged all their scores. They took a therapy ed exam. They logged all their scores. They took the retired Pete. They logged their scores. What I do, and you can do this on your own, I go through and highlight everything in green that they're passing. So as you can see, interventions, they passed all 3 times. So I'm like, you rocked there. Okay. If you look at musculoskeletal, they didn't pass the first Pete because they needed a 600, but they were close. But they passed the second 2. So I'm like, that's a strength 2. The yellow I always do as, okay, you're almost there. So that 599, they needed a 600, right? So they were really close. Neuro, if you look at neuro, they didn't pass that and they weren't close at all. So me, giving this student advice is you better start with neuro. That's the second biggest component, part of the exam, and you haven't passed it at all. Now I do want to, and then I always highlight in blue their lowest scores. So cardiopulm was their lowest twice, and then non-systems was once. So probably after the first exam, they studied it, non-systems, and their scores went up, right? So this, students just tell me, I feel like I'm all over the place. And I'm like, if you put your scores side by side and you start analyzing them, you're probably not, okay? I do want to point out to you, for the Pete, a passing score is a 600. You really shouldn't look at percents. For therapy ed exam, a passing score would be a 70%. Okay, so that's what I'm going for. So I want to point this out to you and illustrate it to you. So do you see in tegumentary lymphatics, the student on the first Pete got a 501. They did not pass. Passing would be a 600. They got 71% correct though. Look at their retired Pete. They also got 71% correct, same percentage, but they got a 622. They passed it. Okay, why does that happen? Because remember what I told you, the questions are different levels of complexity. So the first time she took the practice Pete, those were easier questions. And to get a 600, she had to get way more than 71% to get it right or to pass it. On the retired Pete, those were more difficult questions. So she only got 71% correct, but she got that 622, which is a passing score. So hopefully that helps and makes sense for you guys. All right, this is the last section. I'll go through real quick because we're behind, or we're behind more than an hour. And I'm definitely going to leave time for questions, because you guys are doing amazing asking questions. If you have a lot of anxiety prior to the exam, have a study plan and complete it. I want you to go to the exam that day and say, I did it. I made it through the review books. I finished my study plan. I did it. I'm ready to go. Okay. If you have anxiety, seek help. Get help on campus. Some people, they feel better when they make a drive to the Prometric Center prior to the exam. I don't want to get lost that day. I want to know where I'm going. Even walk in, talk to the person. Hey, I'm taking an exam here in a couple of weeks. Can I have paper instead of a dry erase board? You can go ask those questions. Okay. You'll feel better that day. Focus on what you've already done. Okay. I'm freaking out. The exam's 4 weeks away. Okay, are you on task with your study plan? Yes. Okay, look at all the stuff you've completed. Look at all the stuff you've done. Yeah, you still have 4 weeks of studying to go, but you're on task. You're doing fine. Okay, that will help you with your anxiety. Maintain a positive attitude. One of my students said he learned to write positive statements on sticky notes and put them throughout his review book. I've told people, write positive things on index cards and put them around your house. That positive attitude, I can do this, I've got it, helps with your anxiety, believe it or not. The day of the exam, arrive early. Plan to arrive an hour early. They want you there 45 minutes early, plan an hour, okay? A student who took the exam recently, who's doing a residency with us, said, you have to let go of the things you don't have control over. So if there's a computer issue and I have to wait an extra half an hour, you just have to say to yourself, that's out of my control. It's fine. You just have to understand that there are some things out of your control and it'll be fine. Take the tutorial, do some deep breathing. Write some things down if you need to on that dry erase board, 5 minutes tops. So this will happen. I'm nervous at the beginning. I get into the exam, my nerves calm down. Okay, I'm good. And then I run into several difficult questions in a row and my anxiety rises back up. Stop for a second. Take a deep breath and say to yourself, okay, yeah, those last few questions were difficult, but you know what? I answered 100 other questions and I was doing fine. And I have 100 more to go, okay, or whatever. So you just it's a mental thing. You have to talk yourself out of that. Don't let it rattle you, which it will rattle people. Watch your time, an hour per section. If you get behind, you're going to have to start going faster. You start getting anxious. People start rushing. That will increase anxiety. All right, therapy ed. Plan to take our 2-day course. It's in person or online. And with that 2-day course, you get the course manual. The course manual is great. It is your guide, your blueprint, your outline, your cliff notes. And you can see I have the page numbers on my study plan. Use our review and study guide. That is the big review book. It contains 3 exams. Our exams are online. Our exams have 225 questions. Not all review companies do that. It has videos. It has scenarios. We've updated them all. The new app, we have an app. This is great for that formative feedback I talked about earlier. So I've just finished cardiopulm and I'm not ready to take a full practice exam yet, but I just want to go on and take 25 questions today on cardiopulm evaluation. And tomorrow I want to do 25 on cardiopulm interventions. You can use the app for that. The app has 600 questions. And you can, sort it by the type of questions you want to be evaluating your knowledge. Those 3 full practice exams are that summative eval that you want to do. Our exams, you just take them once and you have them. But that's to sit down and take a whole exam in one sitting. Online office hours, you're here. So I'm going to show you the schedule here in a minute. If you want to watch all of our online office hours, you need to do 3 9-week sessions. So I know there's somebody here who said, I'm not taking it till April or July. If you do all our online office hours, if not, if you're like, oh, I'm taking it in October, I really want to come on and do these online office hours, but you're not offering them all in these 9 weeks, they're on YouTube. So you can go and watch them on YouTube, and you can do that. So all of our products are on Therapy Ed website. You can get to all of those things, the app, the course, the review guide, and everything. I had QR codes up here that students told me weren't working, so I got to figure that out and re-put those up there. Okay, and I see a couple comments in the chat, so I'm going to stop there. So this is our online office hours coming up until the October exam. Okay. When it relates to long clinical scenario questions, do you recommend skipping them if you get anxiety when they pop up, especially if they arrive earlier in the section than later? You could. The reason the exam is still 5 hours, but less questions, is because of the scenarios. And they've tested it, and they said that students have enough time. So you could skip those, but you want to make sure, I mean, if you're a slow test taker, I guess I'd have a little trepidation, because if you're a slow test taker, you get to the end of your question set and you're running behind and you skip scenario questions. I guess that's not a scenario, that's not where I would want to be. I think probably what I would recommend, and I've never had this question, so I'm thinking it through. I think what I would recommend is do the questions as they come up. But go ahead and flag those scenario ones so that when you get to the end of your questions set and you're like, okay, I've got time to review, I've calmed down, I want to go back to those scenario ones, you'll have them marked, and you could go back and look at those. Does that help, Christine? I actually don't. So this is another test strategy that I didn't mention. I do tell people to answer every question as it comes up. Why? If you leave some blank and you get to the end of your 45 questions set, and it has taken you more than an hour, and you realize you left 8 blank, you have to go back and answer those. And that just increases anxiety. And now you're going to have to go through them really quick. So what I tell students is, don't do that. Answer every question as it comes up. Mark it for review if you want. If you have time, then at the end of your set, you can go back and review them. If you don't have time, oh my gosh, this took me an hour and 15 minutes. I don't have time to go back and review. What you can say to yourself is, okay, but I didn't leave any blank. I did the best I could on those, and I'm moving on. That's a better situation to be in. You do want to get it down to 2 answers the best you can. So some people will look at a question, they're just like, I don't know. And they just kind of give up on the question, and they just pick from 4 answers. Pick the question apart. Well, what would be the safest thing? This says, I don't know, it gave me an age here or a setting. Well, that wouldn't happen in home care. But use whatever you can to try and get it down to 2. It's very likely one of those is the right answer. Okay. Oh, yeah. So you have a commute to your internship. There are podcasts. Yes, that's a great free resource. There's all kinds of podcasts. You're going to ask me the names of them. I know people like Kyle Rice. I don't know which one he does. People like him. I know maybe people can give you stuff in the chat here. There's an NPTE podcast. PT Final Exam has one. You could listen to our online office hours as you're driving. You could do that as well. Oh yeah, Clinical Files is Kyle Rice. Yeah, people like him. So there's like 3 or 4 that I hear from students that are reputable and people like. So yes, that is a good way to study. You can do that. Is there a way to reset tests you've used in Therapy Ed? I used mine, they're helpful. So our tests are set up where you have access for a year, and you can only take the test once. So if you've taken all 3 tests, or you don't have them for a year, I think you probably could buy them again, maybe, or you could just use our app and go through questions that way. Final Frontier has a podcast. Okay. Yeah, there's several podcasts, and you know, they're free, and that's a great way to study. So yeah. We are doing questions. I want to put my email up there again in case you need to email me about anything. Is there an additional cost associated with the app? Yes. So you can get the 2-day course, you can get the 2-day course with the book, you can get, so we have packages, but you could just buy the app. I'm not sure the price. Tom, if you're on, can you put in the chat or unmute what the price of the app is right now? I don't know. But yes, it is an additional. So we sell packages, but we also know people want to do like just buy the app. So, okay. I thought I
Are we
saw,
allowed to switch between sections while we're taking the NPTE?
no,
Okay.
no. So section 1 will come up, 45 questions. At some point you have to be done and lock them in. You cannot go back to those questions. They're gone when you go to the next section.
Okay, but they're not timing it for us. We're pacing ourselves.
Oh, yeah. Some
Okay.
people, I have some of my students get done in 2.5 hours. Yeah, which I'm like, how are you doing that? But I don't recommend that. But no, everybody will be taking that 15-minute break at different times. Some will be using a full hour per section. Some, no, the 5 hours is you do whatever you want with that 5 hours.
Okay.
Yep. Okay, so somebody said it's $50 for the app. So these office hours are at 7 p.m. Eastern time every Wednesday night, recorded, and they're put on YouTube within a day or two. So when you logged in today and you click that little, go to online office hours, if you look a little bit further down, there's also a link that takes you to all the ones recorded on YouTube. Okay, so this online office hour obviously was me doing a lot of talking and just giving you the information. Most of our online office hours are not like this. Most of our online office hours obviously are giving you PT content, but there's a lot of embedded questions so that you can test your knowledge as you go through. So they are done differently than what we did tonight. So exam simulated questions.